Assalamu alaikum everyone, and we will be continuing from our topic last week, homosexuality in ancient Greece as compared to the 21st century. So last week we would have stopped at the differences. Today we will be continuing from similarities and go on to a few more subtopics. So the similarities. Homosexuality existed in both the 21st century and in ancient Greece. In both eras, ethics and morality have impacted homosexuality. People were expressive about their sexual orientation in both eras. Despite men being superior in ancient Greece, there was still some intolerance to homosexuality. Likewise, in the 21st century, there are still cultures that are intolerant to homosexuality. Education played a major role in ancient Greece as well as the 21st century. Now, mental health issues as it relates to homosexuality. Psychological research in this area includes examining mental health issues, including stress, depression, or addictive behavior, faced by gay and lesbian people as a result of the difficulties they experience because of their sexual orientation, physical appearances, issues, eating disorders, or gender atypical behavior. Now, psychiatric disorders. In a Dutch study, gay men reported significant higher rates of mood and anxiety disorders than straight men, and lesbians were significantly more likely to experience depression, but not other mood or anxiety disorders than straight women. Physical appearance and eating disorders. Gay men tend to be more concerned about their physical appearance than straight men. Lesbian women are at a lower risk for eating disorders than heterosexual women. Gender atypical behavior. While there is not a disorder, gay men may face difficulties due to being more likely to display gender atypical behavior than heterosexual men. The difference is less pronounced between lesbians and straight women. Minority stress. Stress caused from a sexual stigma, manifested as prejudice and discrimination, is a major source of stress for people with a homosexual orientation. Sexual minority affirming groups and gay peer groups help counteract and buffer minority stress. Ego, dystonic sexual orientation. Conflict between religious identity and sexual orientation can cause severe stress, causing some people to want to change their sexual orientation. Sexual orientation identity exploration can help individuals evaluate the reasons behind the desire to change and help them resolve the conflict between their religious and sexual identity, either through sexual orientation, identity reconstruction, or affirmation. Therapies. Ego dystonic sexual orientation is a disorder where a person wishes their sexual orientation were different because of associated psychological and behavioral disorders. Sexual relationship disorder. Some sexual orientation is mixed orientation marriage may struggle with the fear of loss of their marriage. Sexual relationship disorder is a disorder where the gender identity or sexual orientation interfaces with maintaining or forming of a relationship. Now we'll touch a little on suicide as it relates to homosexuality. The likelihood of suicide attempts is higher in gay males and lesbians, as well as bisexual individuals of both sexes, when compared to their heterosexual counterparts. The trend of having a higher incident rate among females encompasses lesbians or bisexual females, when compared with homosexuals or bisexual males. Lesbians are more likely to attempt suicide. Studies dispute the exact difference in suicide rate compared to heterosexuals, with a minimum of 0.8 to 1.1 times more likely for females and 1.5 to 2.5 times more likely for males. The higher figures reach 4.6 times more likely in females and 14.6 times more likely in males. Race and age play a factor in the increased risk. The highest ratios for males are attributed to young Caucasians by the age of 25. Their risk is more than halved. However, the risk of black gay males at that age steadily increases to 8.6 times more likely. Over a lifetime, the increased likelihoods are 5.7 times for white and 12.8 for black, gay, and bisexual males. Lesbians and bisexual females have the opposite trend, with fewer attempts during the teenage years compared to heterosexual females. Through a lifetime, The likelihood for Caucasian females is nearly triple than that of their heterosexual counterparts. However, for black females, there is a minimal change, less than zero point 0.1 to zero point 0.3 difference, with heterosexual black females having a slighter, higher risk throughout most of the age-based study. Gay and lesbian youth who attempt suicides are disproportionately subject to anti-gay attitudes, often have fewer skills for coping with discrimination, isolation, and loneliness, and were more likely to experience family rejection than those who do not attempt suicide. Another study found that gay and bisexual youth who attempt suicide had more feminine gender roles adopted to non-heterosexual identity at a young age and were more likely than peers to report sexual abuse, drug abuse, and arrest for misconduct. One study found that same-sex sexual behavior, but not homosexual attraction or homosexual identity, were significantly predictive of suicide among Norwegian adolescents. Now, the types of homosexuality. The first one is facultative and obligative homosexuality. The second, compulsive, systematic, and episodic homosexuality. Third, institutional homosexuality. The fourth, gender reverse homosexuality. Now, its relevance to Guyana. The rights of same-sex couples currently stand at one of the most contested issues across the globe. However, while discourse on gay rights in the West focuses on the marital and adoption rights of same-sex couples, in many countries across the globe, consensual adult same-sex intimate acts remain criminalized in Guyana. Guyana also criminalizes these acts of gross, serious indecency, and if convicted, persons may face up to 2 to 5 years of imprisonment in Guyana. Guyana is the only country in South America to criminalize homosexuality under colonial era laws, and LGBT people still often face discrimination. While many other countries have legalized homosexuality, Guyana is still hesitant of doing so. Hence, there was a campaign held recently. Campaigners in the country risked arrest on Saturday, June 2, when they took the streets for a pride celebration. Marchers called for legal reform to decriminalize homosexuality, relax restrictions on transgender people, and permit same-sex couples to gain legal recognition. Groups including Caribbean Equality, the Guyana Rainbow Foundation, Guyana Trans United, and the Society Against Sexual Orientation Discrimination, SASAD, Guyana took part. Guyana is seen to perceive that gay men and lesbians are sources of both symbolic and realistic threat to society. This perception is grounded in acceptance of negative stereotypes, mostly exaggerated and ill-founded beliefs, about gay men and lesbians. For instance, gay men and lesbians are often stigmatized as immoral, violators of gender norms, child abusers, and threats to public health in Guyana. It is thus not surprising that one of the most cited arguments levied against extending basic human rights to gay men and lesbians is that such actions will harm the fabric of society. Due to this, there is a lot of hating and domestic violence against homosexuals in the Guyanese society, as they are not tolerant of individuals' preferences of whom they really want to be, or for those persons that are still trying to figure out what they want to be. It follows that if persons genuinely believe that gay men and lesbians are same-sex, sexual acts harm society, then they would be more inclined to support anti-gay laws that would not see it fit to extend basic rights, human rights to individuals who they believe threaten their way of life, which is currently a big issue in Guyana. So understanding the perceived usefulness of the anti-gay laws in Guyana is warranted, as it may avoid advocates in understanding some of the roots of anti-gay sentiment. We will end there today, but as our discussion on homosexuality, it's currently a topical issue that it's being it's not being kind of balanced, but it depends on how we see it. All that I'm basically saying, we're all humans at the ending of the day. We have our rights, we have our basic human rights, and it's just being asked that regardless of the gender role, that we're able to see each other for whoever we are, and the basic human rights to be given to all individuals. Thank you.